Employee Wellness Week kicks off on Monday. The annual campaign shines the spotlight on the importance of maintaining employee well-being. The Heart and Stroke Foundation says heart disease and stroke are a heavy toll on the country. It also has a death rate second only to HIV and AIDS. Let's discuss with this now with the Foundation's Perch Karp. Thank you very much for joining us this morning. It is something that we've neglected quite significantly across various industries, this idea of employee wellness. Maybe talk us through what exactly that is before we get into the details of the risks that come with not taking care of yourself.
Okay, the primary goal for 2022 Employees Wellness Week is to encourage employees and employers to understand the importance of living a healthy lifestyle and adopting healthy behaviors. As a foundation, our focus is on non-communicable diseases, and in particular cardiovascular diseases and cerebrovascular diseases. This is important because South Africa is faced with a quadruple burden of diseases, where non-communicable diseases, including heart disease and strokes, HIV and AIDS, and tuberculosis, injuries and accidents, as well as maternal, newborn and child health are colluding. Cardiovascular diseases and cerebrovascular diseases are the highest burden of disease in South Africa. Heart disease, strokes, and associated risk factors may be prevented by adopting healthy behaviors.
Right. Now, one would be concerned about that, Perch, in that there is the notion that taking care of yourself or getting good health care is an expensive exercise. And given the current times that we are in, the financial status of many South Africans not being great, many people would neglect this element of taking care of yourself.
That's definitely like that. And that is why we do programs such as these. And with our unhealthy eating habits nowadays, we find that people are just neglecting themselves. You know, it's and quick meals, takeaways, and that actually cause us to have the problems with our health. You know, the bad salt, lots of salt, lots of sugar, and the bad fats. It encourages, you know, just so that you have encouraging heart diseases, actually.
Yeah, and I mean, do you find that there is enough education from an employer standpoint where they are giving out the information to their employees on a regular basis so that we can be educated on how to check our wellness and maintain it?
Actually, I don't think so. You know, your boss thinks it's just okay. They can carry on. So you live with stress as well in your employed area, plus at home. And a lot of the employees do not know how to cope with this. Your eating habits. They've got maybe the vending machines or a canteen, but the meals are quick and easy meals. And, you know, trying to get the cheapest sort of for to serve, whereas a healthy diet, a healthier food is a bit more expensive. So it's actually just to carry on, you know, just to make sure that they have the food and that.
Right. And I'm sure this week will also shine a spotlight on how important it is that there are resources for employees to access should they feel the need to maybe see a psychologist or get some counseling for some or other reason, because ultimately most of us spend 90% of the time at the office.
Yes, it will do that, but it's not okay in our program, but we can advise, and people should take up on those things. There's several places have now started doing de-stressing activities in the workplace, so as to help the employers, you know, cope with different things. Because with COVID, as you know, our workplace has changed drastically. You know, some of us have had to work from home, and you didn't have that support from others as well.
No, that's absolutely true. And then, of course, an important element here is to just get a sense from you as to, have you found that there have been increased incidents of strokes and heart diseases over the last 2 years, maybe, and really just how our health facilities are dealing with that?
I can't give you figures at the moment, but there has been a slight increase because now, while we've been at home, we're sitting at home, we're not moving around. We weren't moving around as much as what we should have during COVID. So that gives you a sedentary lifestyle, and that increases the risk for strokes and heart attacks.
Thank you so much for your time, Perch Karp, joining us this morning to talk about the risks around not taking care of yourself. This as we approach Monday, where the week will be observing Employee Wellness Week.